So, my 9-year-old daughter asked me yesterday, Daddy, what is a heart attack? And it got me thinking, how many people in general really know and understand what a heart attack is? So, I'll explain.
With starting motion, I fix the potion that gives us our mental
We
powers.
begin with the prelim, an intro to the info. I'm itching to get distro. This is just a window in the world of Dr. Lingo. Flash and slice a disco. Ideas come in like disco. The name is Common Sense, though. Not to keep this rapping, bro. This is what you don't know. I bet it's just a bro. Take it away from the show. In its simplest terms, a heart attack is the death of heart muscle. Specifically, it's the death of heart muscle from a lack of blood supply. As I explained to my daughter when she asked me what a heart attack was, I asked her what she thought would happen to her arm if someone tied a really tight rope around the top of her arm, otherwise a tourniquet, and they tied it so tight that it cut the blood supply off to her arm. She got the answer right. It would die. The arm would just die. First, it would hurt a lot, just like a person's chest hurts when they first start having a heart attack. Then, the arm would cease to hurt, but the muscles and the other living tissue in the arm would die due to the lack of blood supply. In the arm situation, eventually it would just rot off. Of course, there would be other grave consequences with the arm analogy, like an infection. That infection eventually would lead to sepsis and likely death. Of course, I didn't get into all of that with my daughter. But in the case of a heart attack, the blood supply to the heart, in almost all cases, just part of the heart blood supply is cut off. Typically, this is from a thrombus, also known as a blood clot. But not in the blood clot in the sense of when you think of you heard somebody on the news had a blood clot. That's a completely different situation. That's typically like what we call a DVT or a pulmonary embolism. But that's something to get into on another episode. Now, typically, it's not just a clot that's obstructing the blood vessel. In almost all cases, there's like a gradual narrowing of the blood vessel to the part of the heart by cholesterol deposits, also known as fatty deposits. Those fatty deposits on the lining of the blood vessel, they harden as they age, or they harden as a result of other factors like cigarette smoking, diabetes, and other factors that can accelerate that hardening of the arteries and the hardening of those fatty deposits on the blood vessel lining. Those deposits are a slow, gradual process that takes years to accumulate, but they lead to a narrowing of the blood vessel in a vulnerable area of the blood vessel that when those plaques rupture, a small clot can obstruct the entire blood vessel because the blood vessel is already very narrow from the buildup of those fatty deposits and cholesterol plaque. When that happens, blood flow is cut off to the part of the heart, and that causes the heart attack. If a heart attack or that obstruction of the blood flow happens on a very small branch of the heart, then it thereby only affects a very small portion of the heart muscle. A person may not even seek medical care for this type of heart attack. They may go about their lives never even thinking or even knowing that they had a heart attack. They may attribute their symptoms to heartburn or indigestion, or they may not ever have any symptoms at all. Some people may have thought they were a little short of breath for a minute or a little nauseated, or again, could be completely asymptomatic or without symptoms. As a matter of fact, a lot of people will have multiple small heart attacks like this, never seek out any medical care at all, and then eventually show up at a hospital or a doctor's office with symptoms of heart failure, shortness of breath, easy fatigue, swelling, etc. And that will be a result of poor heart function resulting from multiple small heart attacks. It's not as uncommon as you might think. Conversely, if the obstruction of the blood vessel happens in one of the major blood vessels, like the left anterior descending artery, also known as the widowmaker, or the circumflex artery, or the right coronary artery, or in the worst case scenario, the left main coronary artery, it's really usually a terrible situation. Then, in those cases, a person almost always seeks out medical care. They seek out emergency care right away because the heart muscle is affected to the extent that it's causing too much pain or other symptoms like shortness of breath or feeling faint or nauseated or just feeling impending doom, that they just seek out immediate emergency care typically. In the worst case scenarios, a person with a large blood vessel occlusion of the coronary artery has so much heart muscle affected, or it's the damage to the muscles in the conductive system of the heart, where the electrical conductive system that causes the heart to be coordinated, that it either causes severe immediate heart failure, or an incoordinated rhythm of the heart that leads to sudden death. That is the worst case scenario, obviously. Not to get too far into the physiology of the cardiovascular system, but the heart has to beat in a very coordinated fashion in order to effectively pump blood to your brain, lungs, and your body to keep you alive. Blood has to enter the heart from the body and from the lungs, fill the atria, the two filling chambers that receive blood back from the body after blood has been depleted of oxygen, and the corresponding waste product, CO2, has been released into the blood from the cells of the body. And also, blood has been received back from the lungs after oxygen has been replaced in the blood and CO2 has been released into the lungs to be exhaled from the body. So that process has been coordinated with the ventricles, also known as kind of the bottom parts of the heart, which pump blood to the lungs and to the body so that the atria and ventricles can do their jobs in synchrony. If that process is not electrically synced, then the cardiovascular system, since most of the rest of the cardiovascular system is just really essentially pipes, the whole cardiovascular system would collapse. And, well, in that case, a person dies. And in the ideal situation, what happens is that when a person has a heart attack, they seek out emergency care right away. And the diagnosis of a heart attack is made quickly. And actually, today, a lot of heart attacks are diagnosed in an ambulance before a person even arrives to the hospital. The paramedics will do an EKG in the ambulance, send it electronically to the emergency physician in the emergency department, and they will pick up that it's a heart attack right away. If it's a large heart attack, that can be diagnosed by EKG. Again, not all heart attacks can be diagnosed by EKG, by the way. We'll get into that on another episode. But in the cases that they can be, they'll be recognized in the ambulance, and the cardiovascular team, the cardiologist, also known as an interventional cardiologist that opens up arteries, will be notified even before the person arrives to the emergency department. In those cases, the goal is to open up the blockage before the heart muscle completely dies. Now, if we go back to the analogy of the arm and the tourniquet that we started with, if you were to put a tourniquet on an arm, of course, the arm would be hurting, and if you take that tourniquet off and restore blood flow to the arm before the arm dies and the muscle dies, then really there's no harm. The arm does fine. And that's what a heart attack is. Now, and one caveat to this is that there are less common causes of heart attack, like coronary artery dissections, aortic dissections, coronary artery spasm, anomalous coronary arteries, etc. But those are discussions for another day. Don't forget to subscribe to be notified when we drop new Dr. Keith episodes. And please post any questions you have about this episode or any other medical questions in the comments.